Hello, I am Megan Bibler. I am here talking about three article highlights that we have read this week. My title of this podcast or video is Getting Hitched, and I am a member of the Indiana State Doctorate in Athletic Training Program. So here we go. So today we're focusing on three concepts: healthcare literacy, patient education, and telehealth. At first, you might think, okay, how do I make these three concepts work together? But in reality, through readings and real life experiences, all three can hitch together and work well. So, first off, I'm going to describe what healthcare literacy is. Um, it is when patients do not understand what fully is going on in their life. So it is found in patients with low economic status, comorbidities, and poor access to healthcare. It's also been found in the elder generation and specifically in African American males. So for healthcare literacy, how do you figure out if your patients have it? Is the first question I thought of when I was thinking of it. And so if you find out, like I hand out in athletic training a lot of physical exams, paperwork, consent, and a lot of times I come back and the paperwork is half filled out. So they don't have their doctor's information, they don't know what their PIN number is. And so seeing a lot of that from a patient that can say that maybe they're not understanding fully what they need to be writing down, they're not literate in what they need to be doing in this healthcare world. And so, with anyone who's dealing with patients, take that into consideration. If you see that they're not filling out the paperwork, it might not be just due to laziness, it might be because they don't understand what they need to put down. It's also if they have troubles describing symptoms, they don't really understand what's going on, that can be a sign that they do not fully understand. They're just not literate in healthcare. So I guess with patients with that, you go on and we're going to teach them patient education because that's the one way you can help get them better. So with patient education, the main thing is clear communication. And first off, my main thing is always finding a way to make my patient feel comfortable. So if you do find a patient that hasn't filled out forms fully or isn't really giving you much information, doesn't really seem like they're fully comprehending what you're saying, take a second, sit back, and just try to connect with them. So maybe connect with them through sports, connect with them through a TV show, Jeopardy if it's an elder. And then also when you're doing patient handouts, try to avoid big medical terms. I know that we understand it as healthcare professionals, but not the average patient might not. So anything below or anything higher than 12th grade reading level should not be used on forms. Also, a lot of forms should have pictures and diagrams. People can digest that better than a bunch of words where they just decide not to fully read it. And then one thing that I have found really helpful in patient education, if you are concerned that your patient's not fully understanding everything, is it's a teach back technique. So you tell them what's going on, and then you ask them, so what do you like? What is your issue? Like, have them teach you back what you just told them. Another thing, I guess the main thing I want to put down on patient education is just trying to build that connection so they can feel comfortable saying, hey, I actually don't understand what this is. So then we go on to telehealth. Telehealth is, I wouldn't say the future of healthcare because we already have all the technology to do it. It's just that people aren't comfortable enough to start using it or don't fully understand how to use it. So telehealth can be used in many different ways. It's a web-based communication. It can be used, especially if your patient is having troubles understanding what you're saying, or if you're just a general. It can be used in saying that we can pull up a specialist in that area on a computer screen in the same room as you and your patient, and really make sure that the patient is fully understanding what's going on as well as you are, and you're hearing the specialist orders, and so that you can help communicate with the specialist and with the patient, and making it the best practice possible for that patient. Also, if you are having a patient who is diabetic and needs to do insulin, or has a lot of things to do at home, like taking a lot of medicine if they're elderly or anything, you can do at-home check-ins. I don't know. With that, you have to be able to teach your patient the technology to use at-home check-ins, so that might not be as reliable, but that is a possibility where you can get on a screen. I think 90% of the world has a smartphone, so that has access to FaceTime or something like that also. So you can do at-home check-ins, make sure your patient's really getting it. So putting it all together and getting hitched, these three ideas. If you have a patient with health care literacy issues, then you need to educate them. You need to make sure that they are fully understanding what is going on. And by educating them, you can add in telehealth to help monitor them, or bring in a specialist and communicate through all three of you to find out the best plan for your patient. This is the end of my Getting Hitched series. I hope to have you all listening next week.